Good morning, dear colleagues. It's my pleasure to share with you what I have prepared for the integration session between oral medicine and oral surgery on cervical swelling. And you know that today it's very important to have an interdisciplinary sessions because that would be more interesting for our students. First of all, the lymph node dissection, which is also known as a lymphadenectomy, it is definitely a surgical procedure in which we would the lymph nodes would be dissected, and this sample, which is the very important information, should be sent to check for malignancy under the microscope. It's an operation usually performed as a part of surgical management of malignant tumors. If we look here, we can find out information that we have a lymphadenectomy, and it can be regional and radical, as we can see. So if we speak about the regional lymphadenectomy, it is a removal of some of the lymph nodes in the tumor area. However, we have a radical lymphadenectomy, and it's a dissection of most or all lymph nodes in the tumor area. It's very important to understand one thing, that finding a cancer cells in the lymph nodes is associated with a higher risk of metastasis to other parts of the body and presents a poorer prognosis, of course. We need to know about the region of the lymph node dissection, will depend on the site of involvement. And if we speak about the cervical lymph nodes, it will be for the head, the neck cancers, and of course, as you can see here, thyroid cancers as well. Of course, we know about the indications. However, what is about the contraindications? So I need to highlight the point that there is no absolute contraindications to lymph node dissection. However, lymphadenectomy is not usually performed in patients with a distant metastasis. What would be the common complications in this procedure? I would say that bleeding, of course, but this would show the poor hemostasis, not checking the anatomy in the case of surgery. Of course, later on, the pain would be one of the common complications, numbness, and surgical wound infections. Today, it's very important to approach any kind of diseases by having an interdisciplinary approach, which means that it's not only a surgeon. However, it's a surgeon, pathologist, medical and radiation oncologist, radiologist as well. Definitely, since it's under the general anesthesia, anesthesiologist, and other healthcare professionals, because today we are not treating only the disease, but also we want to improve the quality of life of our patients. So if we look here, let me see. Okay, so I have here the surgical procedure itself. Whenever we do the surgical procedure, it's very important to consider the anatomy, as I said earlier. So we have internal jugular vein and external carotid artery, which we are not supposed to damage at the surgery part. We have internal carotid artery. As you can see here, internal jugular artery and external carotid artery. So this should be definitely considered during the surgical procedure. I would suggest you to read about cervical lymphadenectomy. And here we have a practice essentials where you would also have an idea about the technical considerations, technique, and many more. If we look here, that's also very important to know about the causes. I kept it for the last because one of them is dental decay, for example, but it's not limited to that. By the way, it can be caused due to, for example, a dental extraction. So I have another suggestion for you to read about it, which is the deep neck infection after the third molar extraction. It's a very interesting study that was done by Seda Yilmaz and Burcu Baz, Bora Özden, Umut and Senem Hocam. So here is the link. You should definitely read it. I would end up this by saying that success in surgery is not just about the skills. It's not about the skillful hands, but also about the compassionate hearts and unwavering dedication to a healing. Thank you so much for your time.